Hello, all. My name is Karina Gonzalez, and today I'm here to present to you about the pathways to healing for foster children. I would like to give you better details as the challenges that foster children face physically and emotionally, and also to give you and equip you with the tools to better help them at the psychological level, and of course, give them the treatment that is needed. So children in the foster care system unfortunately have higher rates of mental health conditions. These include PTSD, anxiety, depression, abuse, and neglect, amongst other symptoms that make their lives difficult day by day. The frequent change in location is the leading cause for a lack of proper medical care that is so needed, especially during the teen and developmental stages. They don't get the proper care, either physical and emotional care that they need for a proper development. They tend to also miss a lot of doctor's appointments, and their medical records get misplaced because of the constant placement changes. Additionally, the lack of proper nutrition affects them at the physical and mental level. It has been found that about 30 to 80% of foster children have a chronic medical condition like asthma, lack of dental care, developmental disabilities, or obesity. An additional health disparity is the developmental delays. Many foster children do not speak, walk, or show emotional maturity at the expected age range. These issues are so triggering that oftentimes they end up finding refuge on substance abuse such as drugs or alcohol. They're also at a higher risk of being sexually abused because of the lack of parental supervision or just anyone that may care for them properly. Foster children in general face more challenges in their lifetime than anyone who has at least one single parent. When these children face all these health disparities, other sectors end up being affected as well. Individually, foster children end up finding difficulties building trust and secure attachments. Their low self esteem and identity struggles lead them to feeling worthless and unwanted, causing internal anxiety, depression, which oftentimes leads to self harming or suicidal attempts. At the family level, they grieve for a safe home, and those who know a family member try to hold on to them, even if they're rejected by those individuals. Just the overall thought that they have someone that they can go to, that they can call uncle, they call aunt, they can grandma, gives them a sense of pride that they often lack. So they hold on to that feeling so that they can feel like they belong, like they're normal, how they may call it. They never fully understand the concept of having a family, which often leads to difficulty maintaining siblings and other family connections. Communities often fail these uh, group of people. These children find lots of struggles, and there's not enough help so that they can get the support they need. In order to do this, we should be supporting more homeless that are in need. An increase of mental health services are in demand, and more mental health coaches and therapists could definitely make a difference in this population. There has been multiple studies conducted that strengthens the previously mentioned statements. Addressing once more the individual aspect of foster children, it has been found that from between 50 to 80% of children in the foster care system meet criteria for at least one mental health disorder. Additionally, 61% of adolescents in the foster care system have a diagnosed mental health condition. Up to 80% of foster youth experience depression, anxiety, or PTSD. Studies have found that the biological parents struggle with substance use and mental illness, making reunification and increasing the child's emotional distress. Foster parents are also part of the data formation where they experience burnout from managing a child's severe trauma related behavior without the adequate training or even support. There's also data in regards to child welfare agencies and how they face higher caseloads and limited resources to provide consistent support. Hospitals see an increase in emergency visits from foster youth due to untreated chronic health issues or mental health crisis. Systematically, there are multiple inequities that contributed to this data. These include limited access to trauma-informed mental health care, frequent placement changes causing disrupt treatment, lack of continuity in medical records, and provider relationships. Underfunded child welfare system make the support much more difficult for these population, and all these continue to the low contribute to the low levels of care towards foster children in our country. The foster care system in our country includes children from multiple backgrounds and walks of life. Given to the housing instability, they get placed wherever there is availability. Because of these, foster care children lose a sense of who they are and what their culture is supposed to look like. They miss the opportunity to integrate with those with a similar background and find part of their identity in a culture where they can feel like they belong to. For those whose cultures speak a different language, foster children lose the ability to learn this language or the native tongue, which oftentimes can open doors to their future, but now they're shut because they don't know it. At a spiritual level, they do not have anyone to guide them through life as to what to believe instead of questioning the existence of a higher being because it is difficult to believe that anything or anyone cares enough for them. Because if this was the case, they will not be going through all these hardships and they will have someone that loves them and supports them. The lack of spirituality delays the development of a positive and helpful outlook in life because this is the one key feature of spirituality to help believe there's something better to come and that things will work out for the best. Diversity also becomes an issue for this population because they often find themselves confused, given that they try to fit in anywhere in order to find some sense of belonging. Children with disabilities may also experience further disparities due to inadequate access to specialized care, educational accommodation, and stable caregiving environments. The foster care population deals with stressors that are difficult to face without any understanding or strategies. There are many approaches that social workers can use to better understand these disparities and aid the foster care population. To begin with, it's essential to be able to use trauma informed care. This one will prepare us to be able to have that conversation with our client about the abuse they have suffered, either this one being mental or physical. This theory will lead to better understanding a treatment plan that will revolve around creating the needed safety given the trauma. Strength based practice is one of my favorites, given that this one focuses on motivation and builds self esteem. Through this intervention, we will promote resilience, coping abilities, and protective factors instead of only focusing on deficits. Attachment theory is another one that we will uh, benefit from using. And the point or idea behind this one is that we can teach our foster care children that the separation they have experienced is not due to a fault of theirs. This disruption in care, separation, and inconsistent nurturing are challenging challenges that are preventing them from forming the right relationships. Through this intervention, we look to strengthen the caregiving child relationship and support emotional stability. Now, other approaches include ecological system theory and resilience theory, but altogether, these could be a great resource to better help our foster care population. The information that has been shared so far serves us as a guide to better understand the struggles that foster care children face and what systems they can use, so we can use as social workers to better guide them at the emotional level. To reinforce these tools, one essential intervention that could be used is trauma focused cognitive behavioral therapy. This intervention method seeks to treat the primary and most common experiences they live, which are mostly abuse, neglect, and repeated disruptions. This intervention helps them better deal with the trauma and PTSD symptoms. From there, the goal is to give them the appropriate coping skills to better reduce the trauma related symptoms like anxiety and depression. An article that I found very interesting related to the topic was that of mental health intervention for children in foster care. In this one, the author Elizabeth Hambrick examines the effectiveness of mental health intervention for children between the ages of 0 and 12 years of age in the foster care system, a population which with significant higher rates of trauma, behavioral challenges, and emotional distress. The research reviewed 10 evidence based interventions and found that the most effective approach were trauma focused and attachment based therapies, which particularly we can use as trauma focused cognitive behavioral therapy and caregiving involved intervention. The review highlighted that foster children often enter the care with complex trauma histories, making traditional mental health treatments less effective. And if they do not address the trauma and disrupted attachments directly, they find it very difficult to heal. One of the most important findings was that interventions show better outcomes when the foster parents or caregivers actively participated in the treatment, helping strengthen attachment, improve emotional regulation, and reduce behavioral issues. The study also emphasized that many interventions have not been widely tested in community settings, meaning there's still a need for more research and broader implementation. Overall, the article supports the importance of trauma informed, family centered, and specialized mental health services to improve, along with long term outcomes for children in foster care. Altogether, with this information and further research, we'll be able to find more tools to better help not only the foster care children, but also the foster care parents. Health disparities among foster youth are directly connected to child welfare, healthcare, and education policies. Laws like the Family First Prevention Services Act, FFPSA, focus on prevention services to keep the children safely with families to reduce trauma before entering foster care. The Adoption and Safe Families Act promotes permanency and stable placements, which are important for improving mental and physical health outcomes. Healthcare policies like Medicare provide medical and mental health coverage for foster youth, but many still experience gaps in care due to placement changes and provider shortages. Educational laws, such as the Individuals with Disability Education Act and the Every Student Succeeds Act, help protect school stability and access to services, but consistent implementation can still create barriers. These policies show that while protections exist, ongoing legislative reform is needed to improve access, continuity of care, and long term support for foster youth. A major ethical dilemma when working with foster youth is balancing confidentiality with the child's safety and best interest. Social workers often work with many systems, including foster parents, biological families, schools, courts, and child welfare agencies, which can create challenges around what information should remain private and what must be shared. For example, a foster youth may disclose trauma, abuse, substance use, or identity concerns and ask the social worker not to tell anyone. However, the social worker may have a legal obligation to report certain information to protect the child or others. This creates tension between maintaining trust and following mandatory reporting laws. According to the National Association of Social Worker Code of Ethics, social workers must protect client confidentiality while also acting in the client's best interest. To address this dilemma, social workers should clearly explain the limits of confidentiality from the beginning, use trauma informed approaches, and involve the youth in decision making whenever possible. This helps build trust while maintaining ethical and legal responsibilities. To reduce health disparities among young foster children, social workers should focus on trauma informed, family centered, and system based interventions. One key recommendation is increasing access to trauma focused cognitive behavioral therapies, which we also know as TFCBT, and other trauma informed mental health services to address PTSD, anxiety, depression, and behavioral challenges early on. Social workers should also advocate for placement stability, as repeated moves also disrupt treatment, education, and attachment development. Strengthening caregiver support through foster parent training, respite care, and attachment based interventions can improve both child outcomes and placement success. At the advocacy level, social workers should push for stronger implementation of policies like Family First Prevention Services Act, Medicaid, and Individuals with Disabilities Education Act to ensure foster youth have the consistent access to health care, mental health services, and educational support they need. Advocacy should also include improving transitional services for youth aging out of care, including housing support, life skill training, and healthcare continuity. Social workers can also address systemic inequities by promoting culturally responsive care, reducing racial disparities in the foster care system, and ensuring that the LGBTQ plus affirming placements are cared for. Suggested areas for further research include the long-term effectiveness of trauma-informed interventions in community settings, the impact of placement stabilities on mental and physical health outcomes, the health outcomes for the LGBTQ plus youth in foster care, racial disparities, as mentioned before, and disproportionality among Black Americans and Indigenous people in the United States in the foster care system. Barriers to healthcare access after aging out of care, the role of resilience and protective factors in improving long term outcomes, effectiveness of caregiver training programs, and reducing placement disruptions could also be details that could help us as social workers become more informed and be able to provide better support. These recommendations support a stronger social work response focus and prevention, stability, advocacy, and long term healing for foster youth. In this slide, I'm sharing all the references used and all the research that was implemented throughout this presentation. But thank you so much for watching today, and I hope that this presentation was of help to you. Have a wonderful one.